How did the NDP manage to gain 7 points from the last survey done by Abacus Data before the election began and pull ahead of the UCP? There are several factors that contributed to this remarkable turnaround. First, the NDP had a strong and consistent campaign message that focused on defending public services, especially healthcare and education, from the UCP's proposed cuts. The NDP leader Rachel Notley also emphasized her experience and competence in handling the COVID-19 pandemic and the economic recovery. Second, the UCP faced a series of scandals and controversies that eroded their credibility and trustworthiness. These included allegations of corruption, fraud, and misconduct involving several UCP MLAs and cabinet ministers, as well as the party's handling of the COVID-19 crisis and the coal mining policy. Third, the NDP was able to attract support from former Liberal and Green voters who were disillusioned with the UCP's policies and performance. The NDP also appealed to some moderate and progressive conservatives who were unhappy with the UCP's social conservatism and divisive rhetoric. Fourth, the NDP had a strong ground game and a loyal base of supporters who were motivated and mobilized to vote. The NDP also benefited from strategic voting by some Albertans who wanted to prevent a UCP majority government. These factors combined to create a historic shift in Alberta's political landscape, as the NDP took the lead in the polls and won more seats than the UCP in the provincial election. One of the key issues in this election is health care. Both leaders announced improvements to the healthcare system on Saturday, with Rachel Notley focusing on physician recruitment and Danielle Smith narrowing in on obstetrics. Notley, the leader of the NDP, said she would launch the largest healthcare recruitment plan the province has ever seen. She said her plan would attract more frontline healthcare workers, train them faster, and deliver better healthcare for Albertans. She said she would offer signing bonuses of up to $10,000 to attract doctors, nurses, and other allied health professionals. She also said she would create up to 10,000 new post-secondary spaces specific to healthcare and related fields over the next 4 years. Notley said her plan would also help internationally trained health providers and international medical graduates to work in Alberta sooner by streamlining the credentialing process and doubling the number of residency spaces for which they are eligible. She said her plan would reduce wait times, reduce stress on healthcare workers and help families find care sooner, closer to home. Smith, the leader of the UCP, said she would improve access to obstetric services in rural areas. She said she would invest $10 million to upgrade equipment and facilities for delivering babies in small hospitals and health centers. She said she would also work with local doctors and midwives to ensure they have the support they need to provide safe and quality care for expectant mothers. Smith said her plan would address the shortage of obstetric services in rural communities, where many women have to travel long distances or relocate temporarily to give birth. She said her plan would give women more choice and convenience in where they deliver their babies. Both leaders claimed their plans would improve health care for Albertans, but they also criticized each other's approaches. Notley accused Smith of cutting healthcare funding and creating a crisis in the system. She said Smith chased away doctors, nurses and allied health professions while closing hospitals and reducing services. Smith accused Notley of mismanaging healthcare spending and failing to deliver results. She said Notley wasted money on bureaucracy and consultants while ignoring the needs of patients and frontline workers.